Hi, I'm Dr. Claire Spencer, co-founder at My Menopause Centre, and I'm a GP and menopause specialist. I get asked loads of questions about all the different types of HRT because when you start looking at HRT, there are so many different types, it can be really confusing. I'm going to show you all the different types of HRT. That's the different types of estrogens that you can use, the progestogens, and then testosterone. And along the way, I'll call out which are bioidentical and which are synthetic. And just to remind you, bioidentical means that the hormones are biochemically matched to those that your own body makes. They're sort of precise duplicates. But then the synthetic hormones still plug those receptors, but they're not the same as your own body hormones. First, I'm going to talk about estrogens. And out of all the methods that I talk about, there is far more information on our website. That's mymenopausecentre.com. So first, in terms of tablets. So tablet forms of estrogen are super convenient in that you just have to swallow the tablet every single day. The vast majority of them are bioidentical, that is, they contain estradiol. There is one type of tablet called Premarin, which contains conjugated equine estrogens, and that isn't bioidentical to us. The only thing really to call out about tablets is that although they are convenient, there is a small increase in the risk of blood clots and stroke if you swallow estradiol. And so if you are at higher risk of blood clots, you may want to consider one of the other options. In terms of estrogen patches, there are a number of different brands available in the UK, and the main difference is that they all vary slightly in size. Estrogen patches, and I've got an example here, are small and clear and very sticky. So to apply it, you open the packet. They come with a foil backing, and you can see there that it's quite clear and it's very sticky. So the one side is sticky, the other side is completely smooth. And so what you would do is apply this below the waist on hair-free skin that is clean and dry. And you would put half of it on first, the sticky bit that you can see there, and then unpeel the other bit and stick the whole thing down. Patches are meant to stick through anything. You can shower, you can swim in them, and they shouldn't unpeel. Occasionally they do. If it does come off, you can just literally dry your skin and put another one on. Some people find that the adhesive sticks to the skin and can leave a little bit of residue, and actually something like baby oil is quite good for wiping that off. You change patches twice weekly, so you have one on for 3 days, one on for 4 days, so you always change on the same day of the week. And many of my patients say that they just set an alarm to remind them so they don't forget. In terms of gels, there are two types on the market in the UK at the moment. There's Estrogel Pump Pack, which comes in a pump dispenser like this, and there's Sandrina in little sachets. In terms of application, it's really straightforward. You deliver a little dollop of the gel onto the palm of your hand. It's odorless, alcohol-based gel. And then you would rub it down the back of your arm or your inner thigh. And it's similar for Sandrina, but you open the sachet and squeeze it onto the palm of your hand. The gel takes about 5 minutes to dry. And once it's on, you would want to wait a couple of hours before you wet your skin so you know that it's been absorbed into your system. If you're using more than one dose or more than one sachet, then apply each dose to a separate location. So for example, with Estrogel, you'd put one dose down the back of one arm and then a second dose down the back of your other arm, like so, or you can use your inner thigh. So the gels are really popular. I prescribe lots of them, and they're very convenient to use every day. The only spray on the market at the moment is called Lenzetto, and it comes in this little gizmo. So if I just take the lid off, this is an estradiol liquid spray, and it's dispensed by pressing down the top there. So this is a once daily application, and you put it against your forearm, press it all the way down, and that delivers one spray of clear odorless liquid spray. If you're doing more than one dose, you would put one spray there, move it along, one spray there. The maximum dose is 3 sprays, and so for the third spray, you would move it across to your other forearm. So again, it takes about 5 minutes to dry, and then you'd want to stay dry for approximately 2 hours after. There are a number of different types of vaginal estrogen that can help with the symptoms of vaginal irritation, vulval irritation, vaginal dryness, soreness, painful intercourse, and also symptoms of irritable bladder. I've just got the Vagifem pessary here to show you, because often people ask about exactly what it is. So the Vagifem pessary is a little white tablet that is inserted into the vagina. The most comfortable way really to do it is to make yourself comfortable, maybe lying down usually, and you insert this applicator. Sometimes it's good to put a little bit of lubrication on it if you want to. You want to insert it about halfway into the vagina. Don't force it, and just insert it to a distance that you're comfortable with. You then press this little button on the end. It may shoot out, as it did, and that's just released into the vagina, where it stays. And you'd want to do it at night so it doesn't immediately fall out, obviously. The cream is inserted in much the same way. So it comes with an applicator that you fill with the dose of cream, and then again, lying down, insert it into the vagina and do it at night so it doesn't fall out. The other thing to mention about the cream is some people find the applicator a little bit uncomfortable to use. And if this is you, what you can do is just work out how much cream is held in the applicator, squidge it onto your finger, and then insert it directly into the vagina with your finger. And you can also just gently rub it around the entrance to the vagina as well, if that's where you're getting the discomfort. There are other larger pessaries that are available. There's a gel, and there's also a ring that you insert into the vagina. The GP usually does it for the first time, or menopause specialist, and that stays there for 3 months, where you then take it out and replace it. It is possible to teach you to do that yourself, and that can be another convenient way of getting the estrogen where it's needed into the vagina. I think it's just worth calling out, please read our information sheets on vaginal estrogens, but vaginal estrogens don't have the risks of the systemic types of HRT, because you only absorb a minute, negligible amounts into your body. The progestogens that are available come in 3 main classes. So there are synthetic progestogens, and these are the progestogens that you find in most of the tablets. You find synthetic progestogens in the Evril Conti, Evril Sequi, Fem7 Conti, Fem7 Sequi patches, and that's where the progestogen and the estrogen are mixed together. The only bioidentical progestogen that's available is Utrogestan. That's the trade name for micronized progesterone. And these are little round capsules that you swallow at night. Now, you swallow them at night because they're mildly sedative. They don't knock you out, but there's evidence that they can get you into a deeper state of sleep. There are different ways of taking them. If your periods have stopped, if you're not bleeding when you start your HRT, you may be advised by your doctor just to take one of these at night. If you're still having periods when you start HRT, then what you would do is take 2 capsules at night for 12 to 14 nights of each calendar month, and then that induces a withdrawal bleed. Finally, there is the Mirena coil. Now, most people recoil when I ask if they've thought about having a coil fit, but this is a really efficient way of delivering the minimal amount of progestogen possible into your body. Now, this is a synthetic progestogen, and I don't know if you can see it here, but it's a little T-shaped bit of plastic that sits inside the cavity of the womb. So on this diagram, the vagina is down here. This is the cervix, this is the cervical canal, and then it's released into the cavity here. Now, having a Mirena fit can be pretty uncomfortable, but the pain doesn't last for a long time. There are different ways of giving pain relief as it's being fit. And the Mirena is basically passed through the neck of the womb on this really slim introducer. The Mirena has a number of positives. It is contraceptive. It also stops the vast majority of women having periods, and it can stay in place for 5 years before it has to be changed if you're using it as part of HRT. Some people choose to use testosterone as well, and this is not licensed for the use in women in the UK, but there is evidence that it can help libido with knock-on positive effects on mood, on mental sharpness, cognitive function, and for some women, energy also. In terms of the different types of testosterone available, there are two main types. So there's a cream, which is Androfem, which is only available privately. And on the NHS, Testigel, Testim, Tostran are all gels that can be prescribed and applied in much the same way. So I'm just going to show you Androfem, which I've got here. So to measure out the dose, you insert the syringe which comes with it, and you gently squeeze till you've got about 0.5 mils in the syringe. And then again, you'd put that onto your finger or palm of hand and massage it for about 30 seconds in either the front outer aspect of your thigh or your lower torso. And you'd want to keep that area dry for about an hour after, and it's usually a daily application. I would strongly advise that you move the site around when you're applying it. So move from day to day, apply it in a slightly different place. And that's because you can get extra hair growth at the skin where you've applied it. The Testigels, the gels that are available on the NHS, are applied in much the same way. You just have to follow the instructions exactly as to what your doctor has told you in terms of dosage. We have got plenty of written information on testosterone and off-license prescribing on our website, which is www.mymenopausecentre.com.